Does bariatric surgery control diabetes? Yes, bariatric surgery controls diabetes. Bariatric procedures such as sleeve gastrectomy, Roux-en-Y gastric bypass, and mini gastric bypass have been shown in literature to completely reverse diabetes in 60 to 80% of the patients. Of course, the Roux-en-Y gastric bypass and mini gastric bypass procedures are slightly more effective compared to sleeve in reversal of diabetes. How does this reversal of diabetes happen in bariatric surgery? So it's by three mechanisms. The one mechanism is obviously the weight loss, because the type 2 diabetes is related to obesity and insulin resistance. So the weight loss leads to diabetic control. The number two is because the stomach size is small, you're eating small portions, and because these eating small portions and controlling your diet, the diabetes becomes controlled. But the third and the most important way diabetes gets controlled is by metabolic phenomenon. So when you do bariatric surgery, you see that the incretins, there are some hormones in the body called incretins. Incretins means you have peptide YY, GLP-1, and these kind of lot of incretins are there, which sensitize the body to insulin. So basically in diabetes, you have an insulin resistance. Type 2 diabetes, you have insulin resistance. So the insulin regulates the glycemic sugar control as well as the fat deposition. So once this is impaired, these patients have type 2 diabetes. But once we do bariatric surgery, we actually, most of the patients, the day we do bariatric surgery, from next day itself, we can stop the sugar diabetic medication. The reason is, the moment we do the bariatric surgery, the incretin levels go up, they sensitize the body to insulin, and because of that, the sugar controls becomes better and the sugar gets controlled. So that is the most important mechanism. Do all the patients who undergo bariatric surgery have sugar control? That question needs further deliberation. So basically, bariatric surgery helps control type 2 diabetes. If you have type 1 diabetes, it is never going to be reversed by bariatric surgery. The current recommendations are that if you have a BMI of more than 32.5 with diabetes, or even if you have a BMI of 27.5 with uncontrolled sugars, with a high HbA1c of more than 8 and uncontrolled sugars despite being on insulin or and oral hypoglycemic agents, these two patients, BMI more than 32.5 and with diabetes, and BMI more than 27.5 with uncontrolled diabetes, these two patients, of type 2 diabetes, the diabetes gets reversed in 60 to 80% of the patients who undergo bariatric surgery. Why does it not get reversed in all? Basically, the mechanism is, in type 2 diabetes, normally there's insulin resistance, so the insulin production is high, but the insulin is not working because there is, at the end organ level, there is insulin resistance. When we do the bariatric surgery, what happens is the incretins sensitize and increase the end organ response to the circulating insulin, and because of which the sugar control occurs. But in some type 2 diabetes, over a period of years, there is some amount of pancreatic failure as well. That means the insulin C-peptide levels are coming down. So in those kind of patients, you may not have reversal of diabetes. So how do you predict this? We basically, before the surgery, we do some tests to rule out type 1 diabetes. We look at the fasting and postprandial insulin and C-peptide levels. If the fasting and postprandial insulin and C-peptide levels are normal or elevated, in that case, your diabetes is going to get controlled or reversed by the bariatric surgery. In case your fasting and postprandial C-peptide levels are low normal or very low, in those kind of patients, you may not have a complete reversal of diabetes after bariatric surgery. But even in these patients where complete reversal of diabetes is not possible, uncontrolled diabetes becomes controllable. Patients who are on insulin can be taken off insulin, and patients who are on 2-3 sugar medication, anti-diabetic medication can be reduced to one medication. So in all the patients with type 2 diabetes, the bariatric surgery either completely reverses the diabetes or makes it much easier and brings down the sugars and makes it much easier to control the diabetes.